Coronavirus infections and hospitalizations in the U.S. continue to climb past record-breaking numbers. According to the COVID Tracking Project, there are over 101,000 patients hospitalized with COVID-19 nationwide. Over the past week, the U.S. averaged close to 200,000 new cases per day. On Sunday, California introduced new restrictions, including stay-at-home orders for 3 regions of the state. Those are expected to last through the Christmas holiday as the Centers for Disease Control and Prevention urges Americans not to travel this season. However, there is some optimism as the United Kingdom prepares to launch its vaccine rollout Tuesday. The Food and Drug Administration could authorize Pfizer's candidate for emergency use as soon as this week. The Trump administration's Operation Warp Speed has outlined a distribution timeline that aims to have 24 million people vaccinated by mid-January. Carl Zimmer is a columnist for the New York Times and also the author of the book, A Planet of Viruses, and joins me now. Carl, welcome. It is good to have you with us. What do doctors believe is accounting for the current spike in cases, and what are they expecting in the weeks and months ahead?
Well, what we're dealing with now is it's not Thanksgiving, I'm sorry to say. It's actually what came before Thanksgiving, sort of a general shift of people feeling like they're maybe just kind of tired with all these efforts we were putting into trying to keep cases down. And so people have been gathering more in small gatherings and larger gatherings and tending to spend more time inside as it gets colder. And so you're just having this general boom in cases. And unfortunately, I would expect in the next week or two that we're going to see an even bigger surge on top of this already, thanks to all the traveling that people did for Thanksgiving. And then we go right into the Christmas season.
You know, it's so disheartening to hear that. According to the Wall Street Journal, 18 of the nation's largest public school districts went exclusively to remote learning over the past month. But on Monday, some New York elementary schools reopened for in-person classes. How is the public health thinking regarding schools changing?
Well, you know, we can look at other countries where they have actually made schools a priority. I mean, it's, you know, we have a situation in this country where in a lot of places the kids don't go to school, but you can, you know, go to a bar till 10 o'clock at night. You know, I understand that people's jobs are on the line if you're going to close down bars and restaurants, but you know, what kids are losing is really catastrophic. And in other countries, you do see that it is possible to keep transmission way down at schools if they are, you know, well controlled and they have the support. So we would probably do well to emulate what these other countries are doing, but that actually means supporting the schools. You cannot expect someone who runs a very old school that has not been maintained for decades to be able to keep kids safe with modern ventilation if they don't have that ventilation system. So unfortunately, this means that, you know, we can't just tell teachers to go into schools and teach where places aren't safe. They need that support.
Right, and that's the key here, is having some kind of perhaps more widespread set of standards and an infrastructure that would allow that kind of policy to actually be more widespread in this country. Let me ask you about, on Sunday, Face the Nation, the scientific head of Operation Warp Speed, Moncef Slaoui, said that he has not met with President-elect Joe Biden's transition team. Does that surprise you at this point, and how does this lack of coordination potentially impact distribution of a vaccine?
It's incomprehensible. Imagine that we were in the middle of World War II and having a transition of power, and the incoming officials had no idea where our troops were in the world. That would be a recipe for failure. We can't afford to fail in this war either, and so there has to be a smooth and quite intensive exchange of information, because, you know, distributing vaccines in the next few months is going to be one of the greatest challenges that our country has ever undertaken. and to just forbid government officials from talking to the president-elect and his staff seems dangerous and absurd.
I don't want to be overly dramatic about this or put words in your mouth, but I mean, do you think that this could have an effect on the number of cases here in the United States, on the death toll in the United States because of this lack of coordination that appears to be happening at this point?
Well, vaccination, if all goes as everyone hopes, and if the FDA decides that these two vaccines by Moderna and Pfizer and BioNTech should be authorized, vaccination could start. I'm not being hyperbolic here. They could start next week. It's amazing, and so it will start within the Trump administration. We want that to continue smoothly into the Biden administration, and so once things are going, we want that to continue, because the faster that we get vaccines to, especially to people who are very vulnerable, people, the elderly who are in long-term care facilities, the faster we are going to drive down deaths, and we'll also be driving down the pressure on hospitals. People will still be getting sick, unfortunately. We're still going to need to wear our masks for quite a while, but if we can keep people out of the hospital because they got vaccinated so that they don't get sick at all, or if they do get sick, they only get a mild case, then our hospitals aren't going to break. And we are looking at the possibility of our hospitals, the system's literally breaking in the next few weeks. So we want to do everything we can to avoid that. And part of that means a smooth transition from one administration to the next with these vaccines.
Well, Carl, I know you've written about other vaccine programs around the world. On Tuesday, the UK will start its vaccination program. Russia began their campaign over the weekend, and many have already been vaccinated in places like China and the United Arab Emirates. How are these vaccines different in these respective nations?
Well, these vaccines are built in different ways. So, for example, some of them are made of basically dead coronaviruses. Some of them are made of other viruses that have been engineered to carry the coronavirus proteins. But, the real issue, and the one that concerns a lot of experts, is that we're having some vaccines starting to be given out on a very widespread basis without enough data. And so, for example, in China, there have been upwards of 1 million people who have already gotten vaccinated with vaccines where there is no final clinical trial data that anyone can see. We haven't actually been shown that they work. We haven't been shown the data that shows that they're safe. And yet, China is ready to move out with hundreds of millions of doses just in the next few weeks. This is a dangerous game, and we have to be really careful. We're going to be vaccinating people on a mass scale. We need to be sure that the vaccines that people are getting are safe and effective, and it can be done. It can be done quickly, and we should be glad that the FDA is being very careful in their review. They haven't authorized it yet. You can't get a Pfizer shot yet here in the United States. That's fine, because what that means is that the FDA is making sure that these vaccines are safe and effective.
Well, here in the U.S., we know there has been some reluctance when it comes to the idea of getting the vaccine. Public polling indicates that some are skeptical of this. What are states and the federal government doing to address this kind of skepticism when it comes to actually getting vaccinated?
Well, there are some communication plans that states are working on. Unfortunately, I mean, the experts in this that I've talked to have complained that there isn't a national communication plan. There just isn't. There are various efforts in different branches of government, at the federal level, at the state level, but there's no one really in charge, and that's a real oversight, and that needs to be fixed quickly, because it is crucial that people understand how vaccines work and that they feel comfortable with them. They understand what the evidence is for them. If they have questions, those questions should be answered quickly and readily. And there's going to be a lot of misinformation floating around. I've been hearing plenty of memes that are spreading all over the place of these fake accusations about these vaccines. And, as a journalist, I'm trying to shoot them down when I encounter them. But we really do need a national strategy.
Yeah, we'll be watching to see what it is that the incoming administration says, but that's something we certainly heard from other public health experts as well. Carl Zimmer for us. Carl, thank you very much. Great to have you with us.
Thank you.